Hi guys, welcome to my presentation. Myself Ajin Shah. Today the topic of my presentation is hip joint capsule and ligaments. Hip joint capsule. Hip joint capsule is a substantial contributor to joint stability. It gets origin from the rim of acetabulum and inserted anteriorly into the intertrochanteric line and posteriorly attached to 1 cm medial to the intertrochanteric crest. The articular capsule of the hip joint is an irregular, dense, fibrous structure with 3 thickened regions that constitute capsular ligaments. There are 2 anterior ligaments and 1 posterior ligaments. The 2 anterior ligaments are the iliofemoral ligament and the pubofemoral ligament, and the 1 posterior ligament is the ischiofemoral ligament. Then the ligaments of hip joint. First we can see about ligamentum teres. This ligamentum teres is a flat and triangular in shape. It is attached from fovea capitalis to transverse acetabular ligament and acetabular notch. It is also called as the ligament of head of the femur. It transmits the arteries to the head of the femur and it is tensed in semi-flexion and adduction. In this picture, we can see the image of ligamentum teres. Next, we can see about iliofemoral ligament. Iliofemoral ligament is a fan-shaped ligament that resembles an inverted letter Y, so that it is referred to as Y ligament of Bigelow. It is one of the strongest ligaments in our body. It prevents trunk from falling backwards in standing posture. Here, the apex of iliofemoral ligament is attached to the lower part of the anterior inferior iliac spine, and the base is attached to the intertrochanteric line as upper oblique and lower vertical bands. Then we can focus on pubofemoral ligament. Pubofemoral ligament support inferior-medially. It arises from the anterior aspect of the pubic ramus and passing through the anterior surface of the intertrochanteric fossa. The bands of the iliofemoral and pubofemoral ligaments form a ischiaton anterior capsule. In this picture, we can see that the image of iliofemoral and pubofemoral ligaments which form the ischiaton anterior capsule. Then we can see about ischiofemoral ligament. Ischiofemoral ligament is a posterior capsular ligament. It attaches to the posterior surface of the acetabular rim and acetabular labrum. The hip joint capsule and majority of ligaments are quite strong and that each tightens with full hip extension. That is, it is helpful in hyperextension. This picture shows the image of ischiofemoral ligament. Thank you all for listening to my presentation.